INSPIR webinar that it's being organized in at least 3 countries, Brazil, Mexico, and the United States. And it's a pleasure to welcome you all to the webinar. I am being invited, just so you know, as a former director of JOTA in the United States. I am currently Chief of Staff of International Relations at United Health Group. But I'm speaking here today on a personal capacity. And I have the great pleasure of welcoming to the webinar Dr. Margarita Gómez, who's speaking with us from Mexico. Dr. Margarita has a wonderful career in research and behavioral sciences, and she's going to be able to explain to us today the results of a survey that she and her team conducted on behavior attitudes in several countries from populations in relation to measures that governments are taking as a response to the COVID-19 pandemic. And just to give you a brief introduction to Dr. Margarita, she has a very extensive and very impressive resume, but just to summarize a little bit, she's the inaugural executive director of the People in Government Lab, which is located at the Blavatnik, correct me if I'm saying that wrong,
That's okay.
School of Government at Oxford University. The People in Government Lab is the school's innovation in government project, and it has a very challenging and very rewarding goals to improve the motivation, the responsiveness, and the effectiveness of people working in government. It's a very hard job to do, but Margarita has more than 12 years of experience working to build better governments and better public policy, both in the private sector and the public sector. And she's not shy to difficult positions in the past. She has been, for example, principal advisor of the Minister of Public Safety and Ministry of Defense in Mexico, and founded and led the first behavioral unit in Mexico as well. So welcome, Margarita, and we are very anxious to hear your thoughts on this responsiveness to COVID-19 in the countries that you surveyed. Please tell us everything that you've learned so far.
Thank you so much, Andrea. Thank you so much, INSPIR, for the invitation. It is a pleasure to share with all of you what we have been doing in this project about understanding behaviors around the world, how people are coping with to face the COVID-19, how governments are responding, and also how can we provide some information. I think that one of the most important things that we are missing now is information that can be reliable, that can be rigorous and sound, and give us a little more of understanding of this crisis that we are facing. So I'm going to share my slides and talk about that. I don't know, like, are we getting some questions in the chat, or you let me know how we are going to do it.
So just to organize this structure, forgive me, I should have said that in the beginning. I'm going to let you present your slides, and we're going to have your presentation for 15, 20 minutes, however long you need. I have some questions that I want to ask you. I read the survey and it's super interesting, and I have questions that I want to approach with you. And I also want the audience to participate today. So we're getting questions from them from our YouTube channel and through JOTA. They're sending those questions to me, and I can relay the questions that the audience has for you as well at the end of the webinar. So you can get started.
That's perfect. Thank you so much. So, as we commented, I'm going to talk about this project named Global Behaviors and Belief at the Onset of the COVID-19 pandemic. This means that we were really willing to understand what happened at the beginning of the crisis, how citizens were behaving, and how governments were responding. And just before going deeper on the survey, just a little brief of who we are in the University of Oxford, in the Blavatnik School of Government. So I lead, as Andrea mentioned, I lead the People in Government Lab, which is a global center dealing and trying to understand and to design interventions and then to increase motivations and performance work. We work in different areas in Latin America, in Europe, in Asia, and in North America. And we use a set of disciplines, interdisciplinary perspective, different methodologies to understand and to try to gather more information and knowledge about how can we increase the performance of public servants around the world. And we also have a comprehensive approach, studying the individual, the micro level, the groups and organization, the meso level, and the national level, and focus on different topics. We started last year in October 2019 with the support of Brava Foundation. And about the global COVID survey. So this is a project, and I think that is really important to put and to state this is a survey, a project that started in a coalition from with 12 different organizations, institutions around the world. As you can see, we have Princeton University, Cambridge, University of California, Harvard University, Boston University, and among other ones. And we are 14 different researchers that join efforts in order to design the instruments and the survey that to gather the information that we thought that it was relevant to have, and also to try to outreach as many people as possible. The purpose was, as I said, to gather this information about how people were behaving, how do they perceive the behaviors of others, and how do they perceive that governments were responding to these challenges, in order to inform policy making, in order also to give some data about how can we design better policy interventions. We started to collect the data on March 20th. And we are still collecting the data in order to have analysis through the time during the different times of the crisis. What I'm going to present today here is an analysis that we have done from March 20th to April 5th, just to have a first cut off of the data that we have. So we designed this survey, and with the help of volunteers, we translate the survey in different, around 69 different languages, and we have information that is coming from 179 different countries. The data, as I mentioned, that I'm going to present here, also we just took one part of this data, just the countries where we have the most number of responses, that are 58 countries. And the variables that we were looking were first individuals' behaviors. So we asked people how, if they were following the measures that the countries were recommending, such as washing hands, staying at home, keeping the distance. Also, we explore if they were also willing to have more strict measures, such as curfew, and also fines, some economic fines that can be put if people were breaking the rules. Also, as we know in behavioral science that the behavior of others influence our behavior, we explore how people were perceiving the behaviors of others, if they perceive if others were also following the rules, or if people were just breaking the rules. And an important indicator for us was government response. People trust government actions. If people believe that the government have the capability and the capacity to protect them, and if they were confident that the governments were doing the best possible to protect and to keep them safe. As in the group, we are really worried about mental health, and also about not just the economic problems that the pandemic is bringing to us, but also how this is going to affect our well-being and our prosperity, related not just with economic effects, but also on our health, physical and mental health. We included some measures. We included depression measures, and standard used by different psychologists, and also different worries items to try to gather information about how people were feeling the day-to-day about this pandemic, and some socioeconomic variables. Our data, so as I mentioned, we have now responses of 176 countries. In total, we have gathered information. We have 110,000 responses, which is really huge. And the top 10 countries where the highest responses are coming from are the United States, as you can see. Brazil is the number 2, UK, the third, and Germany. And we have like countries from all around the world, as I already mentioned. So what did we found? We found our first finding is that people around the world, they support and they follow the rules about staying at home, about not attending social gatherings, about washing their hands, about also like informing if they have any symptoms related with the COVID-19, and if they stayed at home. So this is a global behavior that we found. It changed depending of the countries, but in general, people stayed that they were following the rules. I think that is really interesting when we compare with the social norm, because the social norm is telling us more about the real behavior that they are doing. And when we compare like what people what they were doing with the social norm, we see a difference. For example, in the graph B, we can see that 96% of the individuals, they said that they were not following social gatherings. But when we see the perception that they have of what others are doing, they just think that 66% of the people are following and supporting these measures, which means that there is a 30% difference, and that the reality might be that just 66% of the people are really following these rules, and not the 96%. That is what we used to call the normative behavior. That is, this is what people should be doing, but in reality they are not doing that. So there is this gap. And also another important insight for us about how people are behaving in reality is that social norms influence our behavior. And if people believe that others are not really following the rule, they might be breaking the rule, or they might be willing to break the rule because they don't feel that their behavior is gonna make a huge change in stopping the spreading of the COVID. So this is the first thing that we find. This is important because it is giving us some information about how people are behaving in the normative behavior, but also like a close picture of the real behaviors. But also this is relevant because the first graph shows us that a lot of people support the string measures. They support to have, for example, introduce a curfew. 81% of the population say that they were willing to have a curfew. And I think that you will see why they might be willing to have more strict measures than soft measures. And if we compare with the social norm, we will see that 55% of the people support this, believe that others support these behaviors. Our second finding is that a huge majority of people around the world, they believe that the government actions have not been excessive. And I think that this is, for policymakers, this is really interesting because a lot of policymakers were, they didn't want to establish strict measures because they believe that they won't have the support of the citizen, of the society. But what we found in this survey is like people were really, they were supporting the measures taken by the government, and they were willing that they were not really extreme. For example, if we see the graph C, you might not see there, but we have Argentina. Argentina is one of the countries that since the beginning of the crisis, they established really strict measures, and their society didn't think that they were too excessive. So there is a huge majority that they believe that the actions that the government were taking were not really excessive. And then also, like for example, if we analyze the other side of the responses, that are how many people or what were the countries where their people, their citizens thought that the actions that they were taken were insufficient, we see that also this is related with the soft measures that governments took. For example, we have Brazil, the States, Russia, Turkey, that are the countries that have the highest number of respondents that they said that the government's actions were insufficient. And this is really correlated with the measures that governments were taking. And one thing that we found interesting is that government responses has government responses has a negative effect on mental health. And what we saw is like when citizens perceive that government responses were insufficient, they have highest levels of mental health, of depression, and also they have higher levels of worries. And we can see that also in the graph B, where we were analyzing how people perceived that was the public reaction. When they perceived that the reaction was insufficient, the worry index was higher, and also the level of depression were higher. And also, like when the misperception index, that the misperception index is the perception that they have how others are behaving, also have an influence and impact on how people feel in the mental health and in the worries levels. Sorry. Here we can see also, we explore. So once that we have seen that government responses has an influence on mental health and anxiety levels, we explore if governments were taking lockdown, it has any effect on public reactions, also on the perceptions. And we found that when governments were taking lockdown, were deciding to go to have a lockdown, the level of worries were reduced. So what we found here is that the responses that government take has a huge influence on mental health and also on the levels of anxiety that people have. So it's not just about keeping people physically healthy, but also mentally healthy. Mm-hmm. And we did an event study, and we analyzed how specific decisions of some governments has an influence in people's behaviors and in people's perception on how government were responding. And we took the case of Boris Johnson, that in March 23rd, he changed totally the policy that was implemented in UK, and he decided that the lockdown was going to be implemented in UK. And what we found is that it has an immediately impact and change, and it's really high correlated with people believing and feeling that the government response was sufficient, was better, and also has an immediate effect on how people believe that other people will behave. So this is telling us that when we have a strong leadership and when we have a clear direction of what people need to do, it's reduced, not just, it changed the behaviors and help people to follow the recommendation and the measures to stop the spreading of the virus, but also it has a direct effect on people, on people's mental health and anxiety levels. And this is what we can see. So we can see in this graph, we have the line is the before and after. So we did an analysis about before and after of the announcement of the lockdown. And we can see that the level of worries was reduced considerable after the Prime Minister Boris Johnson announced that the lockdown was going to be implemented in UK. And I'm just going to go a little back. And this is the graph. This is the graph that shows us also a difference around the world. So what we are doing now is analyzing different countries and see if this trend is still happening in other countries or is not happening in other countries. I think that the case of UK is really clear because it was an announcement implemented in all the country, and the policy was really clear, and also it was a huge change before the policy that was implemented before and the policy that was applied after the 23rd of March. But in general, what we have seen when we analyze the global data, what we see is that lockdown has an effect when governments start to apply and to implement more strict measures. It has an effect on how people perceive that the governments are responding to the crisis, and also the level of worries and anxiety. And so in general, we found our first results is interesting, and it gives us some information about people are following the rules more than we thought. And also they are supporting strict measures. And this might be because having strict measures reduce the levels of uncertainty. It also gives people more, reduce the anxiety and the level of depression that they might have because of this uncertainty that we are facing. We also can see here that there is a misperception on about how individuals perceive that others are behaving. What we have is when an individual, we ask if they were following the measures, we see that they have really high levels of compliance with the measures. But when we ask them about the others, they feel that the others are not following the measures. And this is what we call in behavioral science a misperception, or also like this might take to break the rule in the future. We are discussing about softening the measures that governments are implementing. This might be important to inform people how others are behaving and to give people information about what are the real social norms. And I think that the final message that is really important and that we found from these surveys that we did is that the decisions that policymakers have, all the decisions that the policy making and the decisions of policymakers are important, not just for control the spreading of the virus and for the effects that this have for the physical health, but also for mental health. And as we know now, the crisis is gonna take longer. It's not gonna finish in the following 2 months, and we really need a strong leadership, also a strong measures to really help people to deal with all the challenges, the mental health, the depression that they are facing in the long term. And I think that is something that we haven't been facing, and we haven't been also governments haven't been analyzing and taking in consideration in order to design the policies that they are having. So this is the first analysis that we have done. We are analyzing now difference between developed and developing countries, and also considering different how personality threats can have an impact on how people follow or not follow the different measures that governments are implementing around the world.
Okay. I wonder, that was a very insightful results that you have for us. Let me ask a couple of questions to clarify some of the points that you mentioned. So, first of all, when we talk about the government responses and the measures that the governments are adopting, there are countries, including Brazil and the United States, where we see a very sharp difference between what central and federal governments are saying and what local governments, including states and city halls, are implementing in terms of responses to the COVID-19. And in both these countries, the United States and Brazil, we see a rhetoric coming from federal governments trying to ease social isolation measures and reopen the economy faster than in states and cities, where we see governments trying to continue to implement lockdown measures, social isolation, etc. So when you have places with this dissonant discourse on the response to COVID-19, can you capture that in your survey that people sponsor it?
So we have an indicator about to divide between country, like the country, the general, the national responses, and also to see the local responses. I don't think that we can capture, because of data power, no, that if there is an important difference between that. But what we can see, like if we extrapolate the country analysis to the local analysis, what we can see is that if we have like double policies, no, at the national level, the leader saying that there is no need to have strict measures, and then at the local level saying that we need to have strict measures, it might have consequence on how people behave. No, it might be less people following the rule. Instead, if like comparing, if we have a common policy implemented at the national and local level. So, and that is happening in different countries. That is happening, for example, also in Mexico, where some states and majors are deciding to have more strict policies in order to control the spread of the virus. And what I think is like what we are doing is increasing uncertainty, and people under uncertainty do not take the best decisions. So it might have a negative impact on how people are behaving and how people are willing to follow the different measures that governments are suggesting or recommending or applying around the different governments.
That makes sense. And speaking of how people follow those measures, a little bit about the gap sometimes between what people say that they're doing and they perceive how they perceive what others are doing and how the others are behaving. And when we do surveys and polls and in politics, use politicians' proxy to what they are really doing. I don't know if that's something that you considered as well, or if you can really trust what people say that they are doing themselves, and comparing that with the level in which the measures are being complied with in different countries to see if they're speaking the truth, basically. How did you deal with that?
So we did two, we used two mechanisms to try to control that. We know that people will try to answer what is socially acceptable, and what we did is first is this comparison between what I do. No, that is not just the 96% of the times I wash my hands. Comparing this with how often I think that others are washing their hands tell us more or less the level of, I would say, not lie, but I think the level of the amount of people that they might not be saying the truth, no? And what we believe is that this social perception about how others are behaving are more accurate about my own my own saying regarding about how I am behaving. That is one point. And the other thing that we did is when we in the survey, which I invite everybody to answer, to reply, as we are still capturing responses, we changed the order of some questions in order to try to control if people were trying to respond in the most sociable, acceptable way.
Mm-hmm. Yeah, I think sometimes people answer what they think the surveyor wants to hear as well.
Yeah, I think that's one. Sorry, I think that one interesting thing is like we know that in online surveys people lie less than when they have someone in front of them. Yes, so it's more. I think that is because of the anonymity. Yeah, they don't see the other people asking, and they feel more secrecy, and they don't know that people won't identify them.
Mm-hmm. Makes sense. And you mentioned as well how you measure the change in answers and behaviors in places where the government guidance changed, and very starkly in the UK, in your example. I think it's possible that in other countries as well, these behaviors are changing when people, I don't know, realize that the virus is not going away, or the pandemic is increasing, the curve is ascending. So in general, for the survey as a whole, not just for mental health, how do you try to capture the change over time in people's behaviors?
So that is why we are still running the survey, because what we want is to have like a analysis about how people were behaving during different moments of the crisis. We can have this more specific analysis of during the time when we have enough data. No, for example, for the case of Brazil, for the case of the United States, or for the case of UK, we have enough data to start to do some analysis about how people were behaving in different points in different moments of the crisis. And also, what we have been doing is analyzing, like comparing, for example, like the lockdown. The lockdown, it doesn't happen in the same time in every country, but it is a crucial moment, and it's a change of the policy that has an impact on people's behaviors and people's perceptions of how others are behaving, how government is behaving. So we are trying to catch that information and to do that analysis during I think that instead of analyzing every different behaviors in different moments, we are trying to find critical moments and critical decisions that can tell us how these decisions are having an impact on people's behaviors.
And do you already have any results to show that in these people approve measures become, do you see those?
Sorry, Andrea, I didn't hear you.
Oh, sorry, we might have a misconnection. Sorry. I don't know if you already have some preliminary results that show that difference. I mean, is there a curve over time in terms of how people comply with measures or trust governments, depending on how this government social isolation measures change? So can you already tell? Or is it early? You said that in the United States and in Brazil, you already have enough data to see different moments in time. So is there, can you already take some conclusions out of these changes?
I think, yeah, we have, for example, in the case of UK, what we have seen is like more people are complaining, no? But also it is difficult to isolate the reasons of why people are complaining, because we have like, in every country, we have like there is an increase of the stringent of policies that governments are doing. It could be at the national level or it could be at the local level. So it is it is difficult to so we have like in in some countries, we have like, I think the compliance of the measure is increasing, but and also now is decreasing, but it's in some countries because they are also like softening the policy. So it's difficult to just separate why is this happening. It's because of quarantine fatigue. It's because of government policies. It is because of lack of clear direction. So there are a lot of hypotheses why this might be happening. No, and I think that from the data that we have from the countries that we have more responses, yeah, the compliance is increasing, at least what the people are saying. Also, like we can see other data about mobility, for example, the data coming from Google, that we can see that in some places there are ups and downs. No, in some, like there are some moments where the compliance are increased or people are moving less, no, and then moving more. So and I think that is what is going to happen in the next months. It's not going to be a linear or a normal curve about how people are behaving.
Ups and downs. That makes sense.
Yes.
So I wanted to get your opinion on a comparison that the Economies magazine made in an article recently. They suggested that the levels of trust in different countries, they measured it by, for example, the World Values Survey. The responses to the pandemic were sort of correlated. So in countries where people trust each other less, they tend to adopt stricter measures because they think that, you know, there's a higher risk from their societies at large and how they are behaving. Do you find in your study any corroboration of that, correlating the level of responsiveness to the measures with the levels of societal trust?
So we have we did. With the data that we have in the survey, we compare trust, no, and how people were behaving. And what we found is that when citizens found, when individuals found that the government response was insufficient, they were they were less willing to follow the measures, and also they have less trust. But what we are doing now, what I am doing with a team, is crossing also. This is the levels, not just like interpersonal trust, but also how people like corruption perception. And what we see in this first analysis that we are doing is that countries that have high levels of corruptions, people trust less, no, and they also follow the measure less. So this is a correlation. Again, we can't have any causality here, but I think that like doing a deeper analysis, we can see that these effects, like lack of institutional capability, and also the perceptions of high level of corruption, has an effect on how people comply to the measures of that governments are implementing. So that is something that we have seen that is happening, and that the data tell us that these other variables play an important role on people adherence to the prevention and social distancing measures.
Yeah, it sounds like there's many offsprings that could come out of your study to certain behave. And how I had is that your study suggests that certain pandemic responses, they impact the levels of depression and anxiety that people show over time, in the short term at least. And you mentioned that might also have an impact in longer term responses. So that was my question. What do you think is the effects that we're seeing of the pandemic in the longer term? And obviously that's not that. We have, for example, a trend forecaster called Lee Edelcott, and she says that the impact of the outbreak will force us into several changes, slowing down the pace, refusing to take airplanes, working from home, entertaining only amongst close friends and family, learning to become more self-sufficient and mindful, which is kind of optimistic. Do you agree with that kind of assessment? Do you see any trends in the long term that you could tell us?
Yeah, I think that, so the first thing that I would say that is important, and that is one of the findings that we have that we didn't have before, that decision making of policy, of politicians, policymakers have an impact on health, on mental health, that we usually are just like focusing on the physical, don't get in sick, don't get in the virus, but on the impact of this decision has on mental health. And what we see, and why do we decided also to have these measures of anxiety and depression, is because we know that high level of uncertainty have a huge effect on mental health, depression, and different problems. And what we see is that, yeah, and in the medium term, we have a disruption. We change our lives in different ways. A lot of us are working from home, and this was a really disrupting change. It happens from night to day. It's like really fast, and it has an effect on our behaviors, on our mental health, and in the long term, it's gonna have a consequence. We have seen that there is quarantine fatigue that is happening already. People that are in some places that are self-isolate, alone, and also we have seen for example, in Mexico, we have been following the levels of violence, domestic violence, which has increased. Every day we are having 155 new gender offenses reported, and more. So this is increasing. So it's going to have an effect on mental health. It's going to have an effect on domestic violence, gender violence, but also domestic violence in general. And I think that these are the kind of analysis that governments should be doing. The different, it's not just about the spread of the virus, is also about the other consequence, the economic consequence that we have been discussing every day about that, but also the mental consequence and the social consequence that this is gonna have. And I think that there is a difference also that we need to discuss more, that about developed or the countries with high levels developing human developed index, and the ones that are in the less developed, where in some cases there is not access to technology, internet. So the challenges are the informal sector is huge, so the challenges are bigger in the developing countries than in developed countries.
Mm-hmm. And I would think that the pressure to reopen economies sooner is also greater in countries that are less wealthy, and that more people are in the informal sector, for example.
Yeah, I think that I'm also analyzing the data. What we have seen is in developing countries, not all the developing countries have taken very strict measures, and we have different cases, and the reason, for example, one of the cases that I can talk more is the Mexican case. In the Mexican case, there is not a mandate on closing, on staying at home. It is just a recommendation, and the reason why government is doing this is because it's recognizing that we have a huge part of the economy that is in the informal economy, and they don't have saving and they need to go out. So this is I think that some countries are taking this in consideration, and for example, other countries, developing countries, that they have taken more strict measures, as Peru, for example, they have seen that it's just a normative measure. No, it is they have a mandate of not going out, but people need to go out, and we can see that because of the high level of the high number of people that are getting sick in Peru, which give us information about people are not staying at home. People can't stay at home. I think that that is an interesting, an interesting consideration, comparisons when we analyze how the decisions that developed countries or countries with high level of the Human Development Index with the others that they don't have the same level of development.
Yeah, a quick comparison on the southern cone is that you can see if you compare Peru with, say, Colombia and Chile, Peru has way higher number of cases, even though the measures were way stricter and they closed their borders. They were the first ones, if I'm not mistaken, in South America to close borders completely. Not even citizens could cross the border and come in and out of the country. And still, it didn't really help in terms of containing the virus. Brazil is, of course, still the champion in terms of cases and deaths in the region, unfortunately. But Peru is a very interesting outlier, if it's an outlier or in that sense. Building on this question of what kind of longer term impacts are we seeing? Do you think that the things that we're seeing now in terms of, say, different trends in mobility and working from home, do you think that these are more permanent changes, that people are really discovering new ways of working and etc. from the pandemic, and that will continue? Or do you think these are just temporary responses? I guess my question is the impacts that you would expect for the larger society, not just from an individual level.
Yeah, I think that this is a really good question. We are like starting a new project analyzing this, but I think that the changes are going to stay, not because we want, maybe in some cases we want, but it's because we don't have a vaccine yet, and yeah, we will have to keep the physical distancing measures. We will have to reduce the number of people we gather together. So this is gonna stay for longer until we have like a vaccine. And also I think that there are some opportunities, and the study that we are starting to do is trying to analyze from the government perspective how can we try to keep some of these changes that are positive to the way that we work. For example, remote work. We recognize that there are in some contexts that is in environments that is difficult to continue having remote work, no, but also that there are some cases where it's possible to continue having remote work. So we need to identify what are those cases, where is possible, how to reduce also all the bureaucratic procedures that governments are taking. No, I'm talking more from the government side, but also this can be applied to other, like for the private sector. No, how can we continue these policies of working remote, because reduce the commuting time, because also in some cases can help us to increase productivity. And one important thing is increase well-being of the people. No, and I think that these are some variables that we should consider in order to try to keep these policies going on after the short term or after the immediate crisis. And I think that we need to understand when is possible, where is possible, what is possible to continue to keep doing, because it can have good benefits. So there are some studies that also, it depends. So I think that there are like a lot of variables. There is a study about remote work in Amsterdam, in Netherlands. And what they found is like personality traits have really important, play a really important role. People that are more extrovert, they miss a lot when they are not in the office. But for others, it might be helpful, but also having some alone time is helpful is good for creativity and for innovation. So there are like different variables that are important, and I think that we should try to learn and to have also a deeper discussion about how this crisis has already moved our starting point. We are not in the same status quo that we were before the crisis, and how can we take this advantage and apply some changes that can stay for longer. For example, from the behavioral science perspective, we know that moving people from the status quo is very difficult. So now we have an opportunity. Now we are living in a natural experiment where we have changed the way that we live. The way that we live very fast. And how can we learn from that?
Mm-hmm. Yeah, so we should do a series of webinars on this topic throughout the year and into next year to analyze these changes. We are almost out of time, but I have two more questions that I wanted to ask you. One is a clarification from one of the members of the audience that is watching today. So she wanted to know, how do you classify mental health exactly, and what do you consider to be mental health, if it's short-term depression, or how do you analyze that?
Yeah, so for the mental health, we use a standard scale, the PH8, and this is a standard scales that is used in psychology to study. So there is a set of items that we analyze, and that we also like integrate in a measure to see where people are staying. So the measure is depression mainly. They measure the level of depression that people have, and this is how we measure mental health. So when we say mental health, is specifically we are talking more about depression. And then we also design some worries items. So it's like we ask people how worried were they on going out, on meeting other people, or on the current situations, and we create an index of a worry index of putting together these different items.
Mm-hmm. Makes sense.
Yeah,
I
just like a follow-up for the question. I think that is really interesting what she is asking, what Monica is asking about how can we measure this in different points in different momentos of the pandemic. And I think that is we are trying to have this, but this is not a panel analysis, so we can really follow up people in the different moments of times. We can have just like a global perception, but there are other teams that they are doing this, really like measuring the different levels, because I think that this is changing also. This is changing, and as we were discussing, Andrea, is changing depending of government announcement, context, environment, yeah, like even the moment of the pandemic. So there are like a lot of factors variables that can affect. I think that there are some of them that we can move in an easier way. For example, I think that government communication and policy decision making, this is something that in some cases, we can modify or control better, and to reduce uncertainty. Sorry.
Perfect. And one final question, save the best for last. And this is really to get your expert opinion and going beyond the study a little bit, because we talk a lot about people's perceptions of others, people's perceptions of their governments. And we know that in the societies that we live today, a lot of those perceptions are affected by fake news and misinformation. So what do you think is the role of fake news in this dynamic? And do you think that it's really having an impact on people's perceptions of safety and their mental health within the pandemic?
Yes, I think that there are like several studies about fake news and how all these fake news impact behaviors of people, and I think that they play a role. no? And mainly there's really interesting study done by Nicholas Axerman, if I pronounce well, from FGV in Brazil, and he has done some analysis how, for example, like the communication of the president in Brazil has an effect on people, how people are responding and how people are behaving, and I think that what I am trying to say is like fake news has an impact on people's behaviors, but also it's important who is the one that is telling the fake news, no? And it has an effect when it's someone that is more visible, when it's someone that it might have is an influencer, no? And this can have like a bigger effect on people's perceptions. I don't know if behaviors, but at least perceptions. And another point of fake news, I think that also we need to recognize that in some countries, we have a lot of people that they are not in social media, they are not in all the internet, and a lot of people don't believe that the coronavirus is real, no? And this is not about fake news. It's more about this. I think that it's a cultural thing. And it has been confirmed by different also leaders, no? This perception that the coronavirus doesn't exist. Yeah.
And where do we go from here? Are you turning these results from your studies to different governments to see if they will change their policy making based on your results?
So we are sharing all the data. So all the data is available at the individual level for other researchers, for journalists. So it's available. We are doing more analysis. So I think that for us it's important also to have a better understanding if people from higher levels of human developed index behave differently from the ones that they are less developed, because I think that there is a need of having a deeper understanding of why in some countries people might not comply with the measures. And our belief is not because they are bad citizens, it's also because their context, their necessities, their possibilities to stay at home is very difficult. And we want to try.
Thank you so much.
Yeah.
No, please, you want to try to understand that
more? We want to try to understand that more with the data that we have, and also try to get a more understanding about how the behaviors are changing during the time.
Yeah, that sounds super important to the times that we're living. I do hope that your findings influence policy making going forward, and I hope that I get the chance to see more results from your studies and your refined investigations in the future. And thank you so much for sharing your results with us today. I hope this was clarifying for everyone else that was watching, and we're gonna stop here. But if anyone in the audience has further questions that they want to share with Insper or Jota, please send them over, and we'll try to answer them as they come. Margarita, thank you so much for being with us here today, and I hope to see you again soon.
Thank you so much, and thank you everybody for joining us.